Yes, thank you.
Okay, we are the participants as of now is, I can see, about 37, 38. It
Others,
should
please
go.
switch off the video and the audio, please. We're good to go live.
Okay.
Yeah.
Let's start.
Yeah, we can start.
Okay. So hello everyone, myself Arshia Kadri. I'm a dietitian and a nutritionist working with Spina Bifida Foundation India as an executive officer. And first of all, thank you all for joining us for today's webinar. I welcome you all on behalf of Spina Bifida Foundation India and the International Federation for Spina Bifida and Hydrocephalus. Just a few instructions before we get started. We'll be running a live question answer session during and at the end of the webinar. It is on the bottom side of your screen. So if you have any questions, just pop them in there. And please do mention your name and country where you are from. If you miss anything, don't worry. We'll be uploading the recording of the webinar on YouTube. So here we go. Today we are presenting a global event, alive, and a global leadership for spina bifida and prevention and research. So brought to you by the Spina Bifida Foundation India and the International Federation for Spina Bifida and Hydrocephalus. Just a little introduction about Spina Bifida Foundation before we get started. So the Spina Bifida Foundation is a registered non-government entity working for treatment, care, support, rehabilitation of children and individuals with spina bifida, formed by medical professionals and families of individuals with spina bifida in India. So far, we have established chapters in at least 15 states of India for betterment of life of individuals with spina bifida. Planning to launch more state chapters in few more states. And we are reaching out to more and more spina bifida people and enlarging our connection in Asia and Southeast Asia. We also conduct CMEs and outreach programs for medical and paramedical communities to create awareness about different types of birth defects and neural tube defects and its management. Today, we also have the Secretary General of International Federation with us, that is Dr. Sylvia Ruzin. So Dr. Sylvia Ruzin is the Secretary General of the International Federation for Spina Bifida and Hydrocephalus, that is IF. Together with IF's members, board members, and IF Secretariat, Dr. Sylvia Ruzin is dedicated to building positive futures for people with spina bifida and hydrocephalus, and to reduce the incidence of neural tube defects and hydrocephalus by primary prevention through improving maternal health literacy, raising awareness, political advocacy, research, community building, and human rights education. So now I request Dr. Sylvia to share a few introductory remarks on IF and to introduce Dr. Karmarkar. I welcome you, Dr. Sylvia. Over to you.
Thank you so much for your kind introduction, Arshia. As Secretary General of the International Federation for Spina Bifida and Hydrocephalus, I also welcome each one of you. It's so good to see that you have found your way to this digital meeting room, and it seems that we have over 150 participants from all over the world. Next slide, please. As International Federation, our highest value is the promotion and the protection of human rights for people with spina bifida and hydrocephalus. Of course, we can all make a difference wherever we are, but it's about making change happen together. We are therefore very grateful to host this webinar in collaboration with the Spina Bifida Foundation India and the Emory University, featuring 3 special guests. Next slide, please. For us as an international federation, food fortification is an important tool for SBH prevention, especially in times of a pandemic as we are facing right now. An example of IF's work is Smarter Futures, a partnership that supports various stakeholders to make fortification reality and improve health on a global level. Today, it's a story of 3 passionate people who set an excellent example of how they got inspired to make it their life's work to fight for the rights of people with spina bifida and hydrocephalus. The story is all about empowerment, which may serve as an inspiration to also strengthen your work in your communities. Today is the 3rd of October and the International Awareness Month for SBH. It's therefore an honor to have our special guest talking about the topic of prevention. More information on the World Spina Bifida and Hydrocephalus Day taking place on October 25th, you can also check out our website. It's www.worldspinabifidahydrophalusday.com. We look forward to join the efforts together with you to raise awareness for persons with SBH and SBH prevention. And also to give you some heads up, there will be another international webinar coming up during the day on the 25th of October, and more information will come. Next slide, please. And without further ado, it is my absolute pleasure to introduce to you again Dr. Santosh Karmakar, who has an outstanding track record in the field of spina bifida as a senior consultant pediatric surgeon. And he also has an interest in effective prevention measures for spina bifida and hydrocephalus. Dr. Karmakar is a former board member of our international federation, and throughout our collaboration, prevention was also highlighted to be an important topic as we allied on the first international conference in Asia, New Delhi in 2018. Dr. Karmakar is also a public health activist and an editor-in-chief. And furthermore, he feels inspired by the work done by Dr. Oakley's and Dr. Conchella's work by taking global leadership on SB prevention and research. And between you and I, he's also an excellent interviewer. So we look forward to learn more on the global leadership for SBH prevention during this interview today. Dr. Santosh Karmakar, the floor is yours.
Thank you very much, Sylvia, for that warm and kind introduction. At the outset, let me say good morning, good afternoon, good evening, and maybe good night to a lot of people from across the world who have chosen to join us in what promises to be a really exciting 1.5 hour of conversation. So warm welcome to everyone. It is really opportune and very timely that we have this dialogue today, because October is the World Spina Bifida Awareness Month, and the 25th of October, as Sylvia mentioned, is the World Spina Bifida Day. So I'm really happy to welcome Dr. Godfrey Oakley, and I firstly would like to thank him for agreeing to participate in this webinar from across the 7 seas and tell us some very exciting stories of life, to give up insight into his vast experience in this field, and of course, to guide us about what can be done in the years to come. For those who don't know Godfrey, he spent about 3 decades in the prestigious CDC, and he was a former director of the Division of Birth Defects and Developmental Disabilities at the CDC. After spending so many years in the CDC, he left the CDC, but he didn't leave his work. He's as active and as passionate in this area as he has ever been. And therefore, he is known today as the world's leading voice and global ambassador for prevention of birth defects, especially related to folic acid. Godfrey has won several prestigious awards in his illustrious career, and as late and recently as 2020, he won the Kenneth Rothman Career Award from the Society of Epidemiological Research. We are delighted to be having this chat with Godfrey. My chat with Godfrey began about 15 years back when I met him and heard him for the first time in Atlanta, where I went to attend a research society meeting. At that time, I was a doctor who went there to see what's new in VP shunts, what's new in medical techniques. But I came back a changed person after hearing this great man take the pulpit and the high priest of folic acid delivered his evangelical sermon, and it literally swept me off my feet. And I said, apart from just closing the backs, it is important that as Spina Bifida person, I spend my time for prevention as well. So the fire, Godfrey, that you charged in me and gave me is still burning. And I know that over the years, you have fired up so many champions for the work in prevention. And in spite of firing up so many people, the fire within you has not diminished. So we are very happy to chat with you. In this chat, I'm going to be helped by Vijaya Kancherla, who is been an associate of Godfrey for the last several years. And when I first met her, I met her as a junior associate, a student or a mentee of Godfrey. But after 7-8 years of working with him, Vijaya is by herself in her own right an expert in the field of spina bifida prevention. So I'm very happy to have Vijaya help me with this conversation. Friends, we are going to start our chat with something which is very obvious, and in these days of the pandemic which has gripped all of us, we want to ask Godfrey, the first thing we want you to talk about is how you have been in these past few months during these lockdown days, and especially as an epidemiologist who has worked in the powerful corridors of CDC. Tell us your views and your thoughts about the pandemic. And after this, we'll go on to your life and your work in prevention. Godfrey, all yours.
Thank you very much. I am delighted to be here, and I appreciate all the kind words and all the hard work that people have done to try to make this happen. There's so many people for me to thank. Our center would not exist if it weren't for two card-playing bridge women. I play a lot of bridge, and once I said, I need some help raising money, and Janet Edwards and Brenda Shaven raised the money that kept the center afloat for many, many years. Many of my friends have helped keep the center afloat. So it has been just wonderful. I wouldn't be here speaking to you if we hadn't had that opportunity. The two foundations that sponsor this are just fantastic. I've loved working with you guys and appreciate all that you're doing. But probably the biggest thing that's come into my life in the last 8 years is Dr. Conchella. She is more than one could ask for as a colleague. She's just fantastic. And I'm so lucky that she was able to work with me. Many other friends, I can't mention them all, but lots of people have been helping us. So I want to also say that you don't get things done alone. There was a big team at CDC. If you're the president and everything is going well, you get more credit than you deserve. And if it isn't going well, you get dinged more than you should get dinged. Well, that's how it is if you run the division. And since I left CDC, it's become clear that we have our own vaccines to make spina bifida history, and that is food fortification. But in order to make it happen, you have to have the political will in every country to make it happen. And I'm so pleased to be speaking to people from around the world who are physicians and healthcare providers and who are professionals and parents and people affected with spina bifida. You are the people that can create the political will. It has to be done everywhere. About 5 years ago, the MacArthur Foundation said, if you've got a great idea and you win the competition, we will give you $100 million. Well, I could go for $100 million. And so we got 5 partners and we applied. Unfortunately, we didn't win. So they asked again for a proposal a year ago. 5 partners went together, and this time we went past 3 levels of peer review, but in the end, we didn't get there. So I would be remiss if I didn't say my cup is out. I would love to have someone say, here's $100 million for 5 years to help prevent spina bifida. And what this partnership would guarantee we would go from 23% prevention in the world to 50%. So if someone's listening who's got deep pockets, please call me up. I'd be happy to talk to you.
Your brief thoughts on the pandemic.
I will do 2 more things to say, and I will do that. Okay, and that is what we need to do around the globe in every country is either to put folic acid into a common grain like rice or flour or cornmeal, or put it into already iodized salt. Almost everybody in the world eats iodized salt, and that would be a way to get this done. Now I'm happy to talk about COVID. So COVID, my life, like your life, has been turned upside down. And I live in a retirement community, and the people here knew that I used to work at CDC. What they didn't know was I don't know anything about infectious diseases. I'm a birth defects doctor, but I had to say something. And so I said there are 2 things. One is you must be absolutely transparent about anything that happens with people getting sick here. And I think that is true any place. And second, it's going to be much, much, much worse than you can imagine. And I think that where I live, that has not been true, fortunately. They were very, very careful to do all the things that we can currently do. I mean, in fact, it resulted in, if there were a couple and one was sick and the other one was well, they couldn't visit each other for weeks at a time because they did not want to get the infection in the nursing home part of where we are. So that has worked. I think you asked me the other day to mention something about our country, and of course, it's been really tragic.
We will come to that towards
Okay.
the end, because
Right,
we have a lot to discuss. So we are going to go, Godfrey, to the next slide. And I see here that you were born in 1940. Is that true? It's like 8 years back. I don't believe it. You still have the energy, the passion, and the cherubic smile that this young boy here has. So I can't, when I saw this 1940, I looked at it a couple of times before I realized that it's almost 80 years, but you still have the same vigor. But I want you to tell us briefly about your early days, about your childhood, your parents, and how it was in North Carolina in those times.
So it was interesting, and it was a lovely, I've been so lucky throughout my life. This picture is the house that my family moved into in 1945. There was a house, maybe 46. It was being built after there was enough materials to build a house in the US. And my mother lived in that house up until about 25 years ago. That's my sister and me and my father in the backyard from that house. You can see the picket fence around it. And the picture on my right here is my mother, who was 100 then, and she and I were at a competitive duplicate bridge tournament. She was a very, very good bridge player, and she's the reason that I play bridge today. So I hope I'm on the carry plan. I hope I live to be 100 and have my brain working at 100. But if I don't, I'm happy for what's happened so far.
You have the genes to to live up to 100 or beyond. So
Yeah.
let's go to this next slide. And I see that you married at the age of about 21. So tell us something about your marriage, your wife, and your kids.
Well, fortunately, the slide said marrying Marianne Bryant was the absolute best decision of my life. I could not have imagined a life so well if I hadn't married Marianne. And of course, that's just when we were 21 in our wedding party, you know, it was a very happy time. And then 5 days later, I started to medical school. So we went on a honeymoon and I came back and we moved in to a house trailer on a farm. It was 8 feet by 35 feet wide. It's just about the size of a reasonable apartment, maybe in Mumbai. I don't know. It was relatively small for us, but we lived there for 2 years and it worked out just fine. And then this is my
Why we live in these small houses for lifetime. So is good.
I'm back to a smaller house now. I live in an apartment now, and it's perfectly adequate, you know, probably have more space than I need. So this is Marianne, who has developed a lot of arthritic problems. So she's in a wheelchair usually. Then my two grandsons, Jason with the Indiana t-shirt on and Tyler behind Marianne. That's my daughter, Martha, who is a chemistry professor at Indiana U in pink. And the blue is Susan and her husband, Stuart.
And your wife was a lawyer, is a lawyer.
My
Is a
wife is a lawyer, as my wife pointed out to me last night when I was making fun of some woman in a high place. She said, "Did you ever look at your high school grades compared to mine?" Well, of course I didn't, because she won hands down.
Okay, let's move on to after your marriage. I think 4 or 5 years later, you graduated from the medical school, and tell us about those days and how you decided to go on to become an epidemiologist. So tell us briefly about your pre-CDC days.
So I was a country boy. I came from a town that was in a county where mostly they raised bright leaf tobacco for cigarettes. And so I came from a very small town background. My father hadn't gone to college, my mother had. And I went to Duke. And at those days, you could go to medical school with just 3 years. So I applied and got to go to medical school. And I was very happy. And one of the sort of unusual things of my life, the Reynolds Tobacco Company heirs gave me a full scholarship for medical school. So people have been worried that I might promote cigarettes, but I don't do that, of course. And medical school was a wonderful time. I met lots of friends, but I was not the world's best student. So I had to hustle. I didn't play a lot, either at Duke or at Bowman Gray. So I worked really, really hard. This is a celebratory day of me dressed in my gown on graduation day with my sister at that time. Then I was fortunate enough to go to Cleveland in pediatrics, where I worked in a metropolitan hospital and did pediatrics for 3 years. But there was a war going on, and the war was the Vietnam War. And during those times, every person who got a new degree went into the military to be a part of supporting the war effort. If you were planned a residency, you could make an agreement with one of the uniformed services that they would let you finish your residency, and if when you finished, you would guarantee to come work for them. Well, the public health service had about 50 slots out of 3,000, and I got one of those, and I wound up going to CDC. So I look at it as maybe one of the benefits of the Vietnam War was I got to CDC. Otherwise, I'd have never have been an epidemiologist.
Mhm. You were a pediatrician. Is it
Yes.
you also did your qualification in pediatrics?
Yes, I'm qualified in pediatrics, genetics, and preventive medicine.
Fantastic.
So I'm sort of got the right cards to work in birth defects. And of course, I don't practice clinical medicine anymore, but I think my decisions and the quality of my decisions are to this day driven by that experience.
Now let's go to this rather intriguing slide, because if anybody in India saw this picture, they will say, this is a policeman, and Indians are on, like everybody else, are on Netflix these days, and they see a lot of police dramas and crime dramas on Netflix. And if I was shown this or somebody was shown this, they'll say, oh, here's a cop. And so tell us, what is this uniform?
So this is the United States Public Health Service work summer uniform. This was taken at in the parking lot of CDC. And for years, we didn't wear uniforms, but when Chick Coop, the surgeon, became the Surgeon General, he required that if you were a public health service officer, you better buy a uniform and start wearing it. And each of the public health agencies could decide how often. At CDC, I know this was a Wednesday because at the CDC, the director said you had to wear your uniforms on Wednesday. So this is a public health service uniform. The public health service derived from the marine hospitals. There were about 10 of them on the coast of the United States to serve merchant marines and their illnesses. And so that's a tradition that we come from. And there are many people at CDC that come to CDC.
Genesis of this uniform.
Say again?
So that's how this uniform resembles a bit of the Marines and the Navy uniform.
It is a Navy uniform, and when I went to one of the Navy stores to buy buttons once, because the buttons for the public health service are different from the Navy buttons, and the Navy charges you 3 times what they charge for the Navy buttons. I don't think that's fair, but that's how it was.
So do public health officials in the United States still wear these such uniforms?
They certainly do, and you will, and they certainly do. And they're, the high level people at CDC now are 3-star, some of them are 2-star admirals. I was just, as you can see, I was just a captain. I didn't make it to be an admiral, but the guy after me running the birth defects unit was an admiral. So anyhow, I can say I gave birth to an admiral.
Okay, so that brings us, Godfrey, to your 30 years which you spent in CDC. And before I ask Vijay help to take us through your highlights in your work in the CDC. Tell us briefly, because CDC is such a big name and such a prestigious place, that tell us briefly, tell us about how it is working in the CDC, what are the various departments, and how big and how much staff works in the CDC. Because we hear of CDC and we immediately think of the world's final authority on diseases, on prevention, on treatment. So before Vijaya comes in, tell us briefly about the CDC.
Well, like Marianne, going to the CDC was a very, very important part of my life. It is a remarkable, wonderful institution filled with people with the passion and the desire to do well that Godfrey has. It's just an amazing place to work. I was there because, and I got to do birth defects because when I went to the Epidemiology Intelligence Service, which was the way young doctors came to CDC, and you look for a job. Well, I don't like infectious diseases. I never intended to do infectious diseases. And there were only 2 jobs available for me that I was interested in. One was in family planning and one was in birth defects. So the guy running the birth defects picked me to do that. And that was the main decision. So we were a very small part of this, but Dr. Langmuir believed in surveillance and knowing how many of a disease existed. And my immediate boss had set up a program in metropolitan Atlanta to count childhood leukemia because they thought it might be due to a virus. And we set up spina bifida surveillance. We set up birth defect surveillance because the thalidomide problem had just recently occurred, and we had hoped that by just simply counting babies with spina bifida, we would be on the front side of a new epidemic. And of course, we've been fairly lucky. There haven't been major epidemics, but when the science came along that showed that folic acid prevented spina bifida, we had just a dynamite team to help work on trying to make prevention happen. So that's what my days were. One last comment is you can see that my desk is really very neat. Once upon a time, I was in the national news, and the guy who interviewed me sat on the floor and videoed me behind my desk. It looked like I was sitting on top of Kilimanjaro. And so I got lots of calls from other people who keep sloppy desks and saying, I'm so happy to see someone with a sloppy desk and get something done.
Okay. Vijaya, I would like you to take over the conversation and talk to Godfrey about his the work and his highlights during CDC years. And we want to know more about this intelligence service. And you are an intelligence service officer. So we all know it's not the CIA, but it sounds very glamorous. And so Vijaya, please, the stage is yours.
Thanks, Santosh. And again, it's my great pleasure. And I'm so honored to do this interview with you, Godfrey, even though we see each other almost every day when, pre-COVID days, but it feels like an honor to talk to you about your life and introduce you to others on this panel and in the future, whoever's going to listen to this video. So again, I come from CDC as well. I was trained as a postdoctoral fellow for about 3 years at CDC, and I'm so proud to say I am the academic granddaughter of Godfrey. So I trained in a program that Godfrey set up when he was at CDC. So I was a beneficiary of that. So before we go into the EIS, I just wanted to ask Godfrey about his experience in setting up the Metropolitan Atlanta Birth Defects Program, which is considered as the gold standard birth defects program. It's taken as an example. If anyone is trying to set up a birth defects program, they usually refer to reflecting or mirroring what people have done in Metropolitan Atlanta. So Godfrey, could you tell us a story about how that started and your role in it? And then we can also talk about your roots in EIS and how that evolved.
So like I said in my introduction, I get credit for things I didn't do. So I was the second EIS officer in the birth defects program. There had been one who came before me named Alan Eben, and he had worked with a geneticist at the Mental Health Institute in Georgia to set up a surveillance just of Down syndrome. And then they decided to expand it to birth defects. I think the second year Alan was there. So I came in and I became the second EIS officer in this program. And our role was very, very straightforward. If you're an EIS officer, they expect you to do things without any resources. And so Alan had set up this surveillance system. And my job was to go to hospitals and review medical records and abstract those records and bring them back to CDC so we could count the cases. And so we did that once a month. We put out a local surveillance program. That is the basic pattern for any of CDC's surveillance programs. You count as well as you can, and then you let the people who need this information know. So it's that surveillance circle that I participated in, is birth defects. The other thing that I think is important for Metro Atlanta birth defect study is this was not a national study because there was no money. The little money that was there was it dedicated to to establishing something that would give excellent data. And so what we produced in those early years was the best estimate of the incidence of birth defects in North America at that time. It was going on. And it's continued, as you know, to go on. And we've been able to use it to monitor birth defects, but perhaps more importantly is to train people to think about birth defects and how do you prevent them and how do you count them? And someplace about 10 years afterwards, the opportunity came to do something in environmental health. And as one of my supervisors said, people care about not having babies with birth defects and not having babies with mental retardation. So we set up an additional surveillance system patterned on the birth defect system that covered epilepsy and mental retardation and cerebral palsy to try to build the same thing. And that has grown independently and is now equally known around the world for that particular subject matter. In fact, it was in that program that you came to CDC.
Wonderful. So let's focus on your years as EIS officer. I have several friends who are EIS officers, and they talk about the projects they do as a part of their EIS. So do you have anything that's a lesson for us as what you have learned during your EIS years that you would like to share?
You know, the work you do in epidemiology is usually pretty hard work, and you do it in this sort of, you don't get the answer to something that's really exciting every day. So I would say out of the setting up birth defect surveillance in Atlanta, we repeated and learned things that many people, particularly the British epidemiologists, knew. And so we learned, I think the new thing that we learned was that the incidence of Down syndrome, rather than being 1 in 700, as was in the textbook, was only 1 in 1,000. And we were criticized as not knowing how to count Down syndrome. But what any good epidemiologist knows, you need to figure out what the age distribution of the births in a population is to know what the expected is. And it turns out that compared to Europe at that time, Americans had their babies at a much younger age. So a rate of about 1 in 1,000 or 1 in 1,100 was absolutely accurate in what you would predict based on the maternal age structure. Now that is turned around now, and now in 1980, 5% of Atlanta births were to women over 35. Now it's almost 25%. And that has increased the Down syndrome rate by 50%. So one has different feelings about that, about who you are, but if it's gone in that direction for a while, maybe social norms and habits could change and lower the rate of Down syndrome. And for me, it would be a function of being nice for our society to be nicer to young people so that they feel comfortable with their reproduction at younger ages than they currently are feeling.
I've always heard you, I mean, you're very passionate about neural tube defects, but this is the other defect. I hear you talking about something that's preventable, something where there's a social change needed to support or supportive structures, both in the society as in at work and at home to support women in a way that they are able to make a choice to have babies sooner than to delay it. So it's great that we had an opportunity to talk about this today as well. Next slide, please. Okay, so there are some other birth defects that you have also talked about, and we have published a paper together about preventive, which have a preventive aspect. Some of the birth defects are hard to prevent, but there are still a lot of birth defects that we can prevent. So your role at CDC, again, has contributed to bringing these to focus. So could you talk a little bit about some of the preventive birth defects that globally we should be aware of and policymakers should be made aware of? What are some easy, as they call it here, low-hanging fruit, which we know something can be done cost effectively in a public health perspective. So would you like to share about some of those defects that you think are important that we also talk about?
Well, I think the lowest hanging fruit is congenital rubella syndrome. The way you prevent congenital rubella syndrome is to use the measles vaccine mumps measles vaccine that already existed and just put the rubella vaccine in there. It cost almost nothing to do that. And so we should have, as you've heard me say before, I'd like to see a contest between the people that are trying to prevent all of spina bifida F versus the people who of trying to prevent congenital rubella syndrome. They're equally preventable, and we could get them done over the next 10 years and save all that money and save all that disease. So me, there's the primary places. The fetal alcohol syndrome was discovered by one of my mentors and his student the year after I left his program. And one of the stories that I like to say is that this guy, fetal alcohol syndrome, had been in the world forever. It's been there forever. Why did it get diagnosed in 1973? It was a funny, quirky story in which there was a pediatrician married to an obstetrician who worked in the city hospital in Seattle. And she collected as her hobby babies and followed up babies that were born to women who were drunk when they delivered. And out of 10 years of doing this, there were 8 children that she was particularly concerned about. And she asked Dr. David Smith to spend one afternoon in clinic and see if he could learn something. And he took Dr. Ken Jones, who now is the god of fetal alcohol syndrome in the world. He was Dave's fellow then, and they went there and they examined these 8 babies. They were hotshot clinicians. And on the way back, Ken told me this story, so I'm not talking out of school. He said, Dave said, well, Ken, what'd you think? Ken said, boss, I didn't see anything. And David Smith, who was a genius at looking at patterns, says, 4 of those kids had the same thing. That's what we now know is the fetal alcohol syndrome. They published shortly thereafter. His next fella called me or sent me a letter, said, do you remember Mrs. So-and-so that you and Dr. Smith examined when you were in Seattle? And I said, no. She said, well, you didn't know what caused it. And Dave didn't know what caused it. So that case went into the unknown box. And once somebody had made the association between those symptoms and alcohol, we then had a diagnosis. And so for me, even the guy who made the diagnosis didn't make the diagnosis because he couldn't make it looking at them one at a time. There somehow had to be some sort of clustering, some sort of concentration for him to see it. So that's a clinical epidemiologic lesson out of that. The next thing you have here is a formula that in which kids were dying from what should have been a genetic disease. And it turned out to be that there was a change in the way a baby formula was being made. And when they would buy soybeans for this, if it was bought in an alkaline solution, which they often were, they would have, I'd call it junk growing in it, whatever it was. And they'd have to have a step of cleaning it up when they were using it. Somebody decided, well, let's collect it in an acetic solution, which they did. And they wound up having a baby formula with no chloride in it. And and babies' kidneys cannot manage their clearance process without enough chloride. And the company knew that sodium was bad for you, and they titrated how much sodium was in the fluor, but they didn't measure chlorine. And so as a result of that, all the formula laws around the world now require that they measure both sodium and chlorine before they put a batch out. The next one was I think a surveillance program in France was responsible for finding the association between a anticonvulsant, depakine, and valproic acid. And we learned in 1982 that it causes a 22-fold, not 20% increase in spina bifida. And this is another one of the low-hanging fruits. One should be very, very careful about prescribing any woman of reproductive age valproic acid. It certainly should not be the first-line drug. And I think there's work for us and others to do around the world at fixing this problems. You heard me complaining about there not being enough money. This slide brings that up. We were at the birth defects program. We had very little money, but the country got extremely concerned about whether being a Vietnam veteran caused babies to be born with birth defects. And we had a surveillance program that was the best in the world. And it had a way to contact all the women in Atlanta over 12 years who had had babies with birth defects. And so we said when the Congress asked, could we help with that? And we said, yes, we can do this with enough money. So the Congress funded the Vietnam era birth defect study. Then they funded even a bigger study. And in the end, that study showed that there was an association, a very weak association between being a Vietnam veteran and having a child with spina bifida. And that served as a scientific basis to get all people with spina bifida whose parents had been in the service in the Vietnam era to be paid a disability payment and to have their medical care treated. I actually think in our country that should be the model for every child with spina bifida, would be to have that kind of program. Then, of course, we learned the epidemiology of spina bifida and anencephaly. It was the most intriguing birth defect. And the reason for that is it varied by where you lived. The rates in Ireland were higher than they were in Atlanta. And why was that? We figured it must be a genetic thing. Could it be genetics or could it be due to something environmental? And of course, in 1991, we learned that the predominant factor was a vitamin deficiency, not enough folic acid. And you've heard me say that was, when we learned that, it changed my life forever. We'll talk about that maybe in a little bit more. It's called vitamin B9 also. It's also called Will's factor. And we'll talk about Dr. Wills and her role in finding the role of folic acid in India in 1930.
Next slide, please. Oh.
So,
sorry, I just wanted to say that it's great to work with you because I get to hear all these stories. And, that's the thing that your mentees have benefited from is your experiential wisdom and all the stories you share, where we come from, what has been done, and that to learn as your mentee. This is a great study again that Godfrey would share with us. Is a China CDC collaborative study and a great book actually that he recommends, and I've read it. It's a beautiful book, and it's something that you can read if possible. So Godfrey, again, please tell us about this story.
So they say a picture is worth 1,000 words, and it truly is. This is R.J. Berry, who came to CDC to work with me as an EIS officer. And he was a very internationally oriented person who's also very quantitative. He knew how to make math and computers work. I spent the 1980s trying to find money to do a randomized controlled trial in China. And we wanted to do it in China because in 1981, 82, I learned they had a massive epidemic. And if we could do a proper study there, we could get it done quicker than we could get it done in the United States. So the Congress and the Spina Bifida Association, particularly of America, lobbied Congress for us to get the money to do a randomized controlled trial with some colleagues in China. And about the time RJ and his team were ready to implement this study, the MRC study was published and proved that folic acid would prevent spina bifida. So we no longer needed to do a randomized controlled trial, but we had done a lot of work to set this study up. And there was an important question that wasn't answered before we had fortification that could give either a reassuring answer or a non-reassuring answer if we did it. At the time we made the decision, or the FDA made the decision to fortify the required folic acid in flour, the only studies we had were studies that either had a very large dose of folic acid alone, like 10 times the RDA, the daily amount, or they were studies that also included other vitamins. And our recommendation was for just all women to consume 400 micrograms of folic acid. That had never been tested anyplace. That was an inferential reasoning that one has to do when one doesn't have as much data as one would like. So RJ went to China and worked with his colleagues there, and they did a large community trial in which they showed that if you used folic acid before pregnancy and early pregnancy, in both the rates, the areas of China where the rates were very, very high, and areas that were not quite so high, that the vitamin would bring everybody down to the same rate of spina bifida, which was, now we know, has set the standard. We know from that study and from fortification that about 5 per 10,000 children are born with spina bifida, even when you have fortification, because they're due to other causes. So this is the story of that 5-year project. It's a lovely story. And RJ is, like you, one of these wonderful people I had an opportunity to work with.
Next slide, please. So there are superheroes, fictitious ones, and then there are real superheroes. So I think this slide and the next one is about your friends, Godfrey, who you have worked closely with. Could you tell us about these friendships and how you all professionally shared this passion for prevention of birth defects?
So the man in the middle, in the left-hand photo, is Dr. Richard Smithles, who gains all the credit for having the right hypothesis that a vitamin, or as he would say, a vitamin, might prevent spina bifida. And he did in some early studies, but I know that Santosh described me as an evangelist. That's a bad word if you're a scientist. And when I tell people, it's a science-based evangelism, because when Smithles first published his paper, it was not a randomized controlled trial. And I thought there was probably a problem with his study, the way he had gotten women in the study that explained his finding. And I even wrote a letter to the Lancet that said, as politely as I knew how to say, Dr. Smithles, you're wrong. And of course, 8 years later, it turns out Dr. Smithles had gotten the right answer with the wrong design. But we only learned that when the randomized control trial was done. David Erickson is on his right, and David Erickson was maybe my second EIS officer. I had met David when I was getting my master's in public health. He had been a dentist, had had a child with a significant problem, prenatal onset, and he decided he wanted to devote his life to trying to make a contribution in that area. So we got a master's in public health and epidemiology in Minnesota. And then just by chance, he went to Seattle, and he and I happened to be there at the same time. And this chance meeting has led to a lifetime of friendship and productivity. David was the smart guy in this group. I was the cheerleader, and he was the smart guy. He made sure, like Vijaya does today, that if I said something, it was probably right, because I just say what they tell me to say. On the other picture, or again, these are 3 of my EIS officers. Back up one more time, please. And there's David again, and RJ Berry, who you've seen, and then Muin Khoury, who is a geneticist, a world-class guy on his own. These are the kind of people that come into CDC, permitted me to work with. Pretty change now. So I usually start my lectures by saying, do you know where you were at 5 o'clock on June the 24th, 1991? And of course, nobody knows, and the students weren't even born these days. But for me, that day changed my life forever. Up until then, I did not believe that folic acid or a vitamin could prevent a birth defect. But Sir Nicholas Wall on my left there called me, and I was in a hotel at a birth defects meeting, and I wrote out my life's plan on this piece of paper that nobody can read but me. But basically it says, if you get every woman in the world to take folic acid, you can make the folic acid preventable spina bifida go away. And this provided the beginning of a plan to make that happen. And of course, I never did anything without Dave Erickson, and he's on the right.
And Godfrey, I've heard you say this sheet or this note you wrote down when you were in a hotel. But again, we think that it's worthy of being in Smithsonian for the history of folic acid and how we've how far we have come since then. So,
Or certainly in the CDC museum, someplace. It
Yeah.
needs to be. I protected it.
yeah. Next slide, please. I think here.
And Nick Wald also was the person to find out that the serum AFP levels in the blood were important to diagnose neural tube defects. And he
So-
also, I think, was the one who proposed the triple test.
So let me
Is
just say that Nick Wall is one of the most creative people I've ever made. And what he's able to do that I think gets lost in some other people is, rather than doing a study that he can get published or that he can get money for, he spends his time on trying to figure out what is the study that could actually make a difference. But Jay asked me to talk about what I mean when I say keep your eye on the prize. That's what I mean. Make sure you know what you're trying to do. And he was trying with his AFP was to improve the lives of women who were having this diagnostic test. And he was enough of a physician to know you could use the lab to help with that. And he used that. One we don't think about that he did, it's another wonderful contribution, is he is the guy, because of his inquisitive nature, showed that if people were in a room with people smoking cigarettes, that the people who didn't smoke cigarettes inhaled the smoke and had a chemical you only get from smoking cigarettes in their blood. And that single association is really the basis upon which all the public health warnings about public places. You can now go in restaurants and nobody smokes in restaurants anymore. Nobody knows that Nick Wall figured out how to show that cotinine was in the blood and made that happen. So I mean, I think that's what's so missing from so much of our current science is people don't spend enough time asking the right question. Smithles asks the right question. That got us to where we are today on Spina Bifida. Nick asks the right questions. And he has another question he asked, and he used his epidemiology skills to do this. He found out if you take a pill that has 4 or 5 agents in it, like sort of weak doses of anti-cholesterol medicine and anti-hypertension medicine, if you were to give that to every 50-year-old in the world, you'd make half of strokes and heart attacks disappear. This guy's just an amazing guy. Again, another one of the people that if I hadn't gone to CDC, I would have never met and never had this lifelong relationship with.
You spent time in good company, I must say.
Yes.
Okay. So we are now going to take a short, quick break. We are a little running late, but we'll take some questions. So Vijaya, do you have any questions on your
I have one question. Let me just check.
Can we see from whom?
Okay, this is from Navneet Sai. How is genetic testing helping us know about birth defects?
So, Godfrey, would you like to? Is Godfrey
Maybe
there?
Godfrey's taken a break.
Okay. So
Meanwhile, I think the audience can type in questions. We'll pick up 1 or 2 in the interest of time. So if we spend 1 or 2 minutes, if you have any questions, please type them in the Q&A box, which is at the bottom of your screen.
Yes, so this question about how genetic testing helps us in knowing birth defects. Well, till Godfrey is back, maybe I can answer. There are many genetic birth defects due to genetic abnormalities, which if you do a simple amniocentesis and take the fetal, check for the fetal karyotype, then say, for example, Down syndrome, it's a perfectly genetic birth defect, and we know that the cause is genetic, and so it can be detected. As far as spina bifida is concerned, there have been attempts to try and find out the genetic basis, but there's no definite association between some specific genes and spina bifida. Vijaya, there's one more. Yeah, Godfrey,
And
you're
there's
back.
one more question, which is again a great question to Godfrey, asked by Dr. Parveen Bhalla. So India reduced the folic acid levels by almost 90% of wheat flour and rice fortification in 2018. Spina Bifida Foundation of India, especially Dr. Santosh Karmarkar, has been very helpful in the fight to revert the standards. So these are the standards about how much folic acid can be added as a fortificant to a staple like wheat flour. So what piece of advice will you give to deal with anti-folic acid lobby so as to get the standards right? Godfrey, I know this is something that you talk about. Would you like to share your feedback to Parveen and others who may be working in this?
Yes, first of all, I would like to thank Parveen for all the hard work he's done to help get flour fortified in Ethiopia. He works, in India. He works with the Food Fortification Initiative run by Mr. Scott Montgomery. They do terrific things. They've been working with colleagues in India to try to help make this happen. Some people say, what do you want $100 million for? This is easy to do. It's easy to do the way it has been easy to get folic acid in flour in India. I've been working with Santosh for 15 years and it hasn't happened yet. And the reason it hasn't happened is that there are various reasons that the regulatory authorities never get to yes. And what that $100 million is spent for is to have the right conversations with the right people that finally get this establishment to make the decision that seems so obvious to you and me, but for some reason they find that it is not acceptable. And of course, you never know in which country what the arguments are. And in India, it seems to be one particular scientist who seems, in my view, to be misinformed about the risk. There's no risk for taking a ton of folic acid. It just simply has never been shown to be a risk. It's gotten confused that if you, that they think it's related to making B12 deficiency worse, but it doesn't do that. The reason people with B12 deficiency get worse is because they're not given B12, and you have to make the diagnosis and give them B12. And so there's really a sad thing because the Food Fortification Initiative had worked with colleagues in India and the standard was set in 2016 and it was just perfect. But while we were at your meeting in India in 2018, a regulatory board met and they changed that decision. They essentially gutted it. And so that is what needs to be changed in India. And so I would think that every pediatric surgeon, every chapter of the Spina Bifida Foundation needs to figure out how to get to their political system. This is not a science issue. This is a political issue, and have people understand that the science is there and needs to move that. And when that happens, then I think the resistance will go away. And for some reason that I still don't understand is that the people trained in nutrition do not like fortification. And it's sad to say, but that's what I have run into in many, many countries. And I was thinking about an editorial that I would write, and that is food fortification is the vaccine for solving micronutrient deficiencies, vitamin and mineral deficiencies, because that is exactly what it is. It costs very little money to do this. You get a country vaccinated, and by that I mean requiring folic acid in flour or in salt. Nobody ever thinks about it again. It's so cheap, it saves money. It just happens. But getting over that hurdle is what part of that $100 million it would be spent on. And the other part of that $100 million is to take on a problem that we've seen, especially in Africa, where the regulations have gone through, but some of the people that make the flour cheat, and they don't put the folic acid in there. And so one has to train and help set up and pattern an administrative system that will find who's failing to do who's not following the regulations. And then once that training has been done, we don't have to spend that money anymore. And as I say, with about $200 million in 10 years, we can get the world to 90% and not have to spend any of that money after then. It'll just happen. It will be sustainable. And that's why I continue to work at this. It hadn't happened yet, you know. I'd like to see that happen sometime.
Okay.
This also answers the question. Can you hear me?
Yes.
This
Yes,
also
yes.
answers a question by Dr. Hemant Datta, which I think you covered, Godfrey. Okay, interest of time, let's keep moving. There are other questions which we will try to answer as a text form. But Godfrey, again, we will move on, and Santosh, you can take it from here. And I'll try to answer some of the questions.
Thank you, Vijaya. We have to move on. But Godfrey, I want you to talk about this man, and as you inspired me to take up the folic acid challenge, I guess you call Bill Faggy, if my pronunciation is correct of his surname, as your hero. So tell us about this book and this man. And I know he was a former director of the CDC. So yes, so and you wanted us to show this book and talk about him.
Well, he is the most important living man in public health. Just on Friday, a report that he co-chaired for the National Academy of Sciences laid out the US plan for how you should distribute a COVID vaccine if and when we get it, who gets it first, and so on. The president becoming sick covered up that news, so nobody knows he did that but a few people. But next week, you'll hear people fussing about what he said there, because whatever he said, there'll be somebody who'll disagree with it, but he's trusted, he's good. So I was fortunate enough to be at CDC when he was there. He was already there when I came there. And as a young EIS officer, I went off to Africa for the first 3 months in 1991, where I met a wonderful Indian physician who was working with the Lutheran missions there to do care. And Bill Faggy, I think, is sort of a Lutheran missionary at heart, but knew that the way to improve people's lives was not just through seeing patients one at a time, but trying to prevent the problems in the first time. And he was in smallpox. He was in Africa trying to eradicate smallpox. He was in charge of West Africa, and he was stationed in Nigeria. And he didn't have, one day he didn't have enough money to buy all the vaccine he needed. And he thought, well, is there a better way to do this? And what he said was, well, if we go to where there is an outbreak and we immunize everybody in that village and the 10 villages around it, maybe we can stop it. And sure enough, it worked. And you've heard of this. Surveillance and containment is driving the COVID problem. It was an enormously wonderful thing. So he came back to Atlanta, and I saw him there. And but in the summer of '73, I guess it was, he was asked by the head of WHO, a health part, to go to India to see if he could help in India make smallpox go away. Smallpox had been very, very difficult to make go away. Smallpox was gone from all but 5 countries at that time. And there were people who said, you will never make it go away in India. So Bill Faggy came and found an ardent supporter in someone in the Indian government health establishment, somebody at CIRO, the WHO arm it includes India, who wanted to make this happen, wanted to make smallpox go away, because if it went away, it wouldn't come back. And this book is a story of that. And everybody in the world should read this book. If you care about ever accomplishing anything in your life, he tells you exactly the steps you have to go through. And one of these steps is you have to have political will to make it happen. You need to have the science, but it had been 200 years since the science was available for smallpox, and it hadn't happened. And so, as he said, you got to have somebody who will give you the money to do this. You have to plan it, and then you have to do it. And after a while, you don't need doctors anymore. You need people who know how to put programs on. And so there was an army of people in India who did all the hard work, all the planning for this. And in spite of that, when they started doing good surveillance, the rate of smallpox reported went up. And so the people that were responsible for preventing smallpox wanted his head. How in the world could you make it get worse? Well, he made it get worse because he actually counted the cases that were already there that nobody was counting. And we're having that same problem in spina bifida because people don't count the cases because they die stillbirths and or die early and after birth, and they don't get counted. So they don't get counted. You have to count them. So he then had a meeting in which the head was coming to tell him he had to shut down his project, his containment and treatment. He had to shut it down. And the guy came and started talking, and it's alleged in the book that there was a local person in the smallpox program from a small Indian village. This man had enormous courage, and he stood up and said from the floor to the all-powerful big boss, "You know, sir, I'm just a simple man. I come from a small village, but in our village, we pour the water on the house that's on fire." And that was exactly analogous to what the surveillance and containment was about. And the head man sort of gruffly went off the stage and said, "I'll give you one more month." And that one more month, the tide turned. And Bill Fahey saw that within another 3 months, it would be gone. He got in an airplane and came home so that the celebration could be with the people who actually made it happen, which were all these wonderful men and women from India who they worked with him to try to figure out how to do this, and then they have the courage to do it.
Absolutely. There's a great, interesting chapter of this work which he did in India. So wonderful story, and a lot of things can be applied to the COVID pandemic as well. The surveillance, the containment, and the numbers going up because you are detecting more. So very interesting indeed. Godfrey, let's move on. I mean, this is a slide which we have been discussing with you now, and shows you with spina bifida and folic acid, and how you say that if the world wants to reach its sustainable development goals, then this is the way forward.
Let me
But
just say,
let's come to your.
let me just say it a slightly different way, and that is, if there's a foundation that wants to make a certain contribution to reducing child deaths in the world, to assist countries in meeting their sustainable development goals, we have a partnership that for $200 million over 10 years will make you so happy at your contribution to improving the lives of children. Give me a call.
So let's move on, Godfrey, to your travels across the world. And I somewhere remember reading that you gave a talk, folic acid fortification, to the Parliament Committee in and also tell us about your stories from across the world. A few interesting stories.
So could we have the next slide? I think that's what the story, where the story's. I want
me to go to
the picture that comes. I want the picture that's got champions in it. There we go. That's the picture I want. This is, whoop, back up, back up, back up one. There you, no. So while you're finding the right slide, I mean, the story is a story of finding champion. That was the right one. The one before that was right. Yeah. The picture. Yeah. So this is a picture of what this is all about. The way fortification happens is someone has to be a champion like Dr. Carmichael in a country and try to bring together and bring the energy to make it happen. If it were easy to do, it's been 30 years now, it would have already been done all over the world. It is not easy for some reason, but we need to try to figure out how to make it happen. Dr. Kondo on the left side there is a urologist from Japan who works on children with spina bifida and did a case control study that showed in Japan, where they do not fortify, that the rate of spina bifida is 2.5 times what it should be. And still, it's a really, I don't quite understand the Japanese government on this, is they don't have a rubella immunization program, and they don't have a folic acid fortification program. So they're having babies with spina bifida and with congenital rubella syndrome that are totally preventable. The next gentleman is makes me look like not an evangelist. He's a real evangelist. He's the son he's a Lyle Thurston from New Zealand. He's the father of a son who's now, I believe, a lawyer, and he has spina bifida. He heard me talk, and he fell for the evangelical line you did, Dr. Carmanca. And he came up to me and said, how do we do this in New Zealand? So there was no money to do it in New Zealand or for us to travel, but Marianne and I decided to visit Perth and to see our friends there, and to go to New Zealand. And he had arranged for me to brief a room full of people that included the nutrition regulators. They were so unhappy with the message I had that they got up and walked out of the meeting in the middle, which just told you how tough it was going to be in New Zealand to get this done. So Lyle was just persistent. And he talked to the food minister, who said, well, we couldn't make this decision alone. We make this in Australia. So she goes to the Australian meeting to meet with the Australians. She comes back and says, the Australians they don't know what this is all about. So I know that Fiona Stanley, who is a pediatric professor in Perth, knows exactly that this needs to be done. She published a paper on it. And she's so famous in Australia that she was the Australian Person of the Year the previous year. She has access to anybody she wants to have access to. So I said more or less to Fiona, fix this. And so she knew how to fix it in Australia. So then that led eventually to both countries writing regulations that were to be implemented in, I think it was 10 years ago, in here, exactly, roughly. And they were going to implement them in September. But a quirk, in July, the Prime Minister of New Zealand put a hold on it. And that good thing has yet to happen in New Zealand because of political nonsense. Meanwhile, it's been implemented fully in Australia, and people have shown it contributes to health equity because poor people have more babies with spina bifida than rich people do, and it solved that gap. It's a wonderful thing to do. So the woman on my right is the woman who she's a geneticist, but she's very skilled in statistical analyses. And she's a woman that with RJ Berry has taken data from various and sundry places and provided for WHO what is now the standard for where everybody's woman of reproductive age blood level needs to be above. Dick Johnson is a pediatrician that I met when he was the head of the March of Dimes medical part. And he heard me give a lecture. And unfortunately for me, he didn't swallow the message. I had lunch with him and he said, I don't believe a thing you said. So I said, okey doke, let's see what we do. So I mailed him the papers that made it clear that what the answer was. And to this man's great honor, he picked up the phone and said, you're absolutely right. The data are solid and the March of Dimes will help you do this. And so when we were trying to get fortification done in the United States, and the FDA had 3 hearings run by the nutrition people who did not want folic acid fortification to happen. And they manipulated this process so that in the end, they said not only were they not going to do it, they would never do it. And so when that got to the March of Dimes, Dick Johnson knew that was an inhumane conclusion. And he knew that the head of the FDA was a pediatrician, and he knew him. And Dick Johnson, who had been in academic medicine, knew how to work the strings of academic medicine and the March of Dimes to provide an argument to the commissioner of the FDA that essentially was finally how fortification got done. It wasn't the data, but it was the March of Dimes and Dick Johnson creating the political will within the commissioner of the Food and Drug Administration. I was not there, but it's my understanding that what really got the commissioner to move was that, I guess, between the Spina Bifida Association and the March of Dimes, they promised the commissioner that the next morning they would bring kids in wheelchairs to his office and they would keep them there until he signed a piece of paper. That was the science. Of course, it wasn't science at all. It's science-based advocacy that got it done in the United States. So, and Cynthia Moore it was the head of the CDC birth defects unit for many years and was the clinician who was on our China project. And she made one of the most amazing presentations after her first trip to China. She'd gone over and reviewed all the 35mm slides that had been born, babies born with all sorts of birth defects. And she came back and showed 5 slides, each of which had 4 babies with anencephaly in it. And anencephaly is the worst form of neural tubes. There is no fusion of the bony parts or from the brain all the way down to the bottom. And in 20 years of surveillance in Atlanta, we had 1 case. And she came back from China with 20 cases in just 1 trip. And she proposed at that time, maybe there was a dose response curve in the severity of the presentation of NTDs. These babies were born in the highest rate of spina bifida we'd ever heard of at that time. And it turns out that I think the neurosurgeon in Costa Rica is writing a paper that shows that in Costa Rica, that seems to be what has happened, is that as fortification happened there, the severity of the spina bifida came down.
Okay, Godfrey, absolutely. I couldn't agree less that there is the science, but what is needed is to create the political will. And the most powerful way is probably to take families and children with spina bifida to the politicians and just make them, if they meet them and they talk to them, I think half the battle is won. So we need to move ahead. We have almost
just one more thing on that is Dr. Fege, my hero, says that what's really important in talking about prevention is to have people know what the face is, but behind the numbers. And I think one of our problems in discussing this with nutrition regulators, they don't really know what spina bifida is. They don't know the enormous energy it requires to be able to provide the best care and the best life for children, you know, and they don't understand about the increased mortality. And I think one needs to, and that's what clinicians and parents can do so well. Just tell them your story so they can see it and touch it and talk to you about it. That's really, really, really good. It's worth more than 1,000 words from that picture.
Yes, absolutely. I think that's the key. Let's go on to some more champions. And this is a slide which has more folic acid champions, and you have been in touch with many of them. Do you want to say something quickly about this? Because we are running a little late. We've been talking for almost an hour and a half now, and we need to move on.
There are 3 people in this slide that I want to point out, and that is the woman to my right in the bottom left-hand corner, which is Professor Velma Freire from Ecuador. She was the WHO nutrition attaché, and she asked, what do we need to do in Central and South America? And she listened, and she got folic acid fortification done all over Central and South America. She's an enormous hero, made an enormous contribution. The woman in the upper right-hand corner was a member of my church who's a physicist, retired from a company, and she didn't know what she was doing when she retired. And I said, help me prevent spina bifida. And she thought about it for 2 days. She said, yes, I'll do that. So I had this highly trained woman who worked for Vijaya and me to do wonderful things. And then the woman below with the clown in her hand is Karen Bell, who was working with me and helped me write the first paper that made an estimate of how many children with spina bifida are still being born in the world. I call it the first map paper. Vijaya is about to submit, or has submitted, the 5th version of that paper that we hope will be published soon.
So let's move on to something which you are engaged with and associated with in the recent years. And this is interesting to the prevention community because you now are proposing and probably are associated with this research or program of trying to fortify salt with folic acid. And I don't know, there was some report from the nutrition department in India, Nutrition Institute, which says that if you add folic acid to salt, the salt becomes bitter. Now, I don't know how far that's true, but tell us more about salt as a vehicle for folic acid fortification.
But it clearly doesn't become bitter. It becomes slightly tinted yellow. And I just point out that folic acid fortified salt is sold by two companies in Europe, and it's sold as a specialty salt. It's absolutely wonderful. You can see at the top of this box, the salt's got iodine, fluoride, and folic acid in it. I can't read German, but I can guess that's what it says. So it's available in Europe, and it turns out in Ethiopia there is no grain that they eat that is processed centrally. So it's impossible to do flour fortification.
It's
They don't
the same to a large extent in India as well.
exactly.
And
So
no,
salt, yeah. And so I was thinking about how do we solve this? And you can discuss supplements. And if you take a supplement, it works charmingly. It's wonderful, but it's really hard to get all women of reproductive age to take a supplement all the time. So there's a man to my right in the bottom picture is a guy named Dr. Tony Magna from from um, Ethiopia, and he worked with his colleagues in Mekelle, and this surgeon had been supported by IF with buying Indian shunts to go to this colleague to operate on babies in Ethiopia. So I got to know um, IF that way and their connections. And we started trying to figure out what do we do about this huge epidemic. And they said, well, there's a guy named Dr. Koning, who's in the upper photo there in Oregon, who's been working in Ethiopia for a long time. He's worked there for 10 years. There were so many babies with spina bifida. They were all dying. And there was a large group of people, children with post-infectious hydrocephalus that were coming to the clinic with soccer ball sized heads or bigger. And they just sterile because they hadn't had a shunt put in. And so he got he's been dedicated. He and his brother, they're twin brothers from Holland. One came to America and one stayed in Holland. They're sitting with me and Nick Wall. I call it me and the three knights because they're both knights in from Holland, and Nick is a knight from the UK. So it was Godfrey and the three knight table. Anyhow, they've been dedicated, and but they also understand that they need to do prevention. And again, it's the surgeons and neurosurgeons who realize that there's no way to manage and get all the care done without doing the prevention. And one of the things that hasn't been published that you will see, and he's a very good friend of mine and he may be listening, so I have to be careful, but I tease him because he's a surgeon and he's not an epidemiologist. So he called me up with this epidemiologic finding the other day that if we made spina bifida go away from salt fortification in Ethiopia, it would immediately make free 18 full-time, fully trained neurosurgeons to do other neurosurgical things like brain cancer, trauma, and so on. So anyhow, that's what's going on there. I believe that they have the highest rates of any place in the world now, and we need to move as fast as we can to control the epidemic there.
So are you convinced that salt could be a great vehicle for fortification?
Absolutely, absolutely. It should be done every place immediately. The only thing that hasn't been done, and this is the part that confuses people sometimes, folic acid has been put in 50 kinds of food or some large number of foods. Every time people eat folic acid, and whatever those foods are, their blood folates go up. And we know that is the critical thing that has to happen is to change, to increase the blood folate of women of reproductive age before they get pregnant. And I am virtually certain that that will happen, although no one, as far as I know, has taken this product and measured bloods from people that use this product. And so we have designed a rather small study that we're going to do and hope to do in Ethiopia that will and will fill that piece in. My own view is the house is burning around down in every country from epidemics to spine. We have our own pandemic. Every country in the world that doesn't have fortified products has an epidemic of spina bifida. And the only question is how big that epidemic is. And I've just read this morning some interesting data I hadn't seen from Haryana, so from India. And they show that the blood folates in Haryana are as bad as the blood folates in Ethiopia. I think spina bifida and anencephaly have yet to be counted in any major hospital as well as the people did in Mekelle. And I would think a highly desirable thing to do is to do a study like that just to show that the rate of spina bifida in India is probably about 100, which is about 20 times what it should be. And that should, to me, that's like COVID. I mean, if the house is on fire, I mean, it's everywhere. So what do? You move and do the things you know how to do. And I would think, for me, that would drive me as a policymaker to put folic acid in the salt and then measure whatever you need to do after that study. But it's just sitting there to be done and will do so much good.
That will encourage a lot of people working in this area in India to explore the possibility of salt fortification with folic acid. So Godfrey,
you have people eat you have people eat a lot of wheat
but they don't buy flour. They buy the grain and they grind it in their local mills.
Yes, but the people in Haryana with the food fortification program have had the government there move to distributing in their public distribution system flour that's fortified, not the grain, and it seems to be working. And so to me, I think they have a proof of concept of a way to reach 40% of Indian families.
Okay, let's move ahead with Vijaya.
Sure.
Are you there, Vijaya? Yes. So
Yes.
would you like to talk to Godfrey very briefly about these? What is your current work in the Center for Spina Bifida Prevention? And then we will go to maybe this last slide about India and quick question answers. Because as I said, we will soon be about 1.5 hours already over, and we should take a few questions. So maybe talk about Godfrey, you could talk about your current work with Vijaya. Vijaya, please go ahead.
So Vijaya, if I might, I think we might have done this already, but we're working hard with the Gates Foundation to tell them the story. And they are listening, and we are looking forward to continuing to tell that story there because they have the resources. If they saw the value, could make something good happen. So that's where we are. There's not much more to say about that. But the last slide is what I would like to talk about because it involves India. And it turns out this wonderful English woman who was a young hematologist left London and arrived in what she called Bombay in 1928. And 3 years later, she discovered the reason that pregnant women in hospitals were dying in late pregnancy from what was called the pernicious anemia of pregnancy. And she discovered that she reproduced it in rats. And then she changed by changing their diet. And she changed their diets back by putting Marmite in the rat food. Now, I don't like Marmite. I wouldn't care if it was only rats that ate Marmite, but there are people that like Marmite. And it was the first demonstration that folic acid can cure or prevent a human disease. And she fed it to the women, and it did that. And this paper was done 3 years later. This is a woman that I view was cheated out of a Nobel Prize, maybe just because she's a woman, I don't know. But this woman's, there've been 8 Nobel Prizes for their work on vitamin B12. And the only one for folic acid was the chemist who synthesized the synthetic form in 1945. This woman deserved the Nobel Prize. She didn't get. And that work started in India. But you know, one of the funny things that we've talked about is that she was in the middle of what had to be in a maternity hospital with a huge epidemic of spina bifida going on all around her. But for some reason, this hematologist didn't see it. Nobody wrote about it. You know, it just wasn't a concern.
Very, very interesting. I mean, yes, we will soon dig into this a bit more and find out which hospital in the then Bombay she was working in. But I'll give you the feedback soon about this. I think it was the Wadia Maternity Hospital, which is not very far away from where I live. So, okay. Vijaya, I think.
Sure.
Okay,
And Dr. Karmarkar, I just wanted to request you to go back to the website so we can just show the website name for our center. Yeah, so it's preventspinabifida.org is the name of our center website.
Okay.
The next one. So it's loading it. Yeah. And again, Godfrey has been a great science-based advocate for helping prevention of spina bifida, primary prevention throughout the world. So if anyone has a question, you can again go through this website. It has the work we're doing, and please reach out to us and we are happy to help any way we can. Thanks. That was a little plug I had to put in there. Thanks.
Sure, Vijaya. Let's probably go on and take a few questions, and after the questions, I think we will wind up. It's been more than 1.5 hours, and I think we'll give some time to questions. So let me see. Okay. There was one question about health insurance for the fetus. So I don't know, Godfrey, it's not a question related to prevention, but do you have any thoughts about that? Because Dr. Vora is, again, a very leading worker in prevention, and he is working in a district in Maharashtra, and he has a pilot project going on about fortifying tea with folic acid. So he's asking this question about how many countries have health insurance for the fetus to cover birth defects. So I don't know whether you would want to answer that or.
Well, I certainly can just give a view on that. I know that over my medical career in the United States, they're primarily led by surgeons who were not getting paid by insurance companies to care for children who were born with birth defects. They managed to lobby the American insurance companies to, most of them, require any insurance policy that was sold would cover the care of children. You've heard this discussion about pre-existing conditions. They were being excluded because they had, quote, a pre-existing condition. And of course, the so-called Obamacare that was brought into the United States 10 years ago or so, that included no pre-existing conditions. So yes, babies with spina bifida would be cared for there, and the surgery would be paid for. A lot of other things that might be needed weren't paid for, but that would be paid for. And I don't know what the global picture on that is. I know that, you know, I'm assuming in the UK it's not a problem because they have universal health care. I think most of Europe is that way. Otherwise, I don't know.
Okay. Any more questions?
I see
Vijaya, do
one
you have
question.
any?
No, I see one question from the audience. How do we assist government to access folic acid premix for fortification? We do work very closely with food fortification initiative here, but Godfrey, do you want to take that question? How can we help governments access premix?
So I think we need to do that offline, but it can be done. The GAIN organization has set up a clearinghouse in Africa for African countries, and I know that food fortification and Parveen and Montgomery have worked out a way to do that in India. It's not a problem once you just make the right telephone calls. It's made, it's available. Lots of companies want to sell it to you.
Okay, so so I think Godfrey and Vijaya, we come to the end of this rather interesting and very exciting discussion, conversation, lots of stories, and we really enjoyed listening to your vast experience, Godfrey, and how you have successfully gone around the world creating champions to take up the cause of birth defect prevention on the global scale. And yes, it is difficult, it takes perseverance, it takes time, but learning from you, if you are at it, and if you get the right people in place, and of course, create the political will, it will happen. And creating political will would mean getting the politicians and the policy makers to interact with families who have children with neural tube defects in spina bifida. I mean, one interaction and their views change completely, and it comes on the top of their agenda. In fact, I have experienced that in the last few years. We have been going around states in India trying to get politicians and bureaucrats to meet families who have children with spina bifida. And had this pandemic not locked us in, this year would have seen some great success as far as implementing, but certainly awareness of the acid and spina bifida prevention. So let me ask you, Godfrey, your concluding remarks and your messages for all of us who are listening and to all the stakeholders in this very important uh, important fight or important campaign to end spina bifida in the world.
So let me just thank you again, and to quote Bill Fagey one more time. And he says, persistence does not guarantee success, but success seldom comes without it. So we must be persistent until we get the fortification done.
Vijaya, would you like to say something to conclude?
Sure. Again, we are here to help, and we are actively looking for champions globally to help in spina bifida prevention. So again, reach out to us, and this is not a job of one person. We need a team. We need a very strong army to work globally to prevent these life-threatening birth defects and help families worldwide. So thanks, Godfrey, for all the work you have done and for setting an example for young epidemiologists and giving us a lesson on translation. So it's not important just to do research, but it's more important to take it out for the betterment of people. So you have been an example for that, and your life story is an example of how to take information and use it. So I'm very fortunate to be working with you. Thank you.
Sylvia, anything that you would like to comment and as closing remarks?
I think this was just an excellent webinar. So thank you, Godfrey. Thank you, Vijaya, for agreeing to be here. I think this was incredibly inspirational, but it also shows we still have a lot of work to go forward. So keeping in mind this month is the awareness month, especially, let's do it together. Thank you, Santosh, for being such a great host and interviewer. Thank you.
Thank you, Sylvia. And I give the mic to our staff member, junior staff member from the foundation, Vaishali, to end the session.
Hello, sir. This is Arsha here. Sir, Vaishali's internet connection is not working, so I'll give the thank you.
Okay, sure.
Yeah. Yeah, so thank you so much, Dr. Godfrey, Dr. Vijaya, Dr. Santosh, and all the participants for joining us and making this webinar successful one. And I would like to thank the International Federation for Spinal Bifida and Hydrocephalus for such a wonderful collaboration. It was wonderful experience for us to know about the fascinating journey of Dr. Godfrey, virtually though, knowing about the folic acid and how important it is for preventing birth defects. I hope many would have benefited and encouraged through this talk with us today. We will look forward to conduct more webinars like these to spread awareness. We are open for feedback and suggestions from all. It really means a lot for us. So you can write to us on sbfsecretary@gmail.com. And for more details, you can visit our website www.spinabifidafoundation.org. Once again, thank you everyone for joining us for today's webinar.
Arshia, there was one question about whether this recording will be available. Could you also address that?
Yeah. This will receive whenever we'll receive this recording of this webinar, we'll upload on our official YouTube page.
Thank you,
Well,
everyone.
thank you, everyone. Thank you for an exciting couple of hours, and hope to see you and interact with all of you soon. Bye-bye.
Bye-bye.
Bye-bye. See you soon.
Yep.